and we'll get started. So thank you everyone for joining us for today's webinar event on Ending Unsheltered Family Homelessness in Washington State. So a little bit about the Learning Communities Resource Center. The purpose of this project is to analyze outcomes across the Community Action Network and recommend effective, promising, and innovative practice models to you all out in the field. Overall, our goal is to help you all build your capacity to fight poverty. And this is of critical importance because anti-poverty work is at the very heart of what we do here in Community Action. So, of course, I mentioned myself, I'm Hyacinth, but here's the rest of our team. We, of course, have Tiffany Marley, who is the project director here on the Learning Communities Resource Center, Jarl Crocker, who is the director of the Training and Technical Assistance Department. Some of our newer staff members, we have Courtney Kohler, who is the senior associate in the TNTA department. We also have Liza Porras, who is our program associate for TNTA. And last but certainly not least, we have Charity Frankowski, and she is the VISTA lead on our Rural Impact Project. So as we like to do with all of our webinar events, we do so by reciting the promise of community action. We feel like this grounds us in our work, and it reminds us why we're all here, why we go into our separate offices across the country. What really unites us together is to improve the lives of families in our community and to make America a better place. So it states that community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So without further ado, I think I'm going to turn things over to Sharon McDonald. I think she has some welcoming words for us. She, of course, is from the National Alliance to End Homelessness, and she's going to kick us off for today's event. So Sharon, you're on if you have some welcoming words.
Excited I am about the potential of the 100-day challenges and for the opportunity that the Community Action Partnership has offered us to kind of share what's being learned. So first we're going to hear from Teresa Fletcher with the State Department of Social and Health Services. We are then going to hear from first Melissa Taylor and then Gina Nugent from the Lower Columbia CAP, and Melissa Hess from the Benton-Franklin Community Action Council. So thank you all for participating, and I'll turn it right on over to Teresa to kick us off.
Thank you. Thank you, Sharon. Thank you, Hyacinth. Good morning or afternoon, depending on where you are in the country. I am really happy to be sharing with you about the 100-day challenges we conducted here in Washington State. My name is Teresa Fletcher, and I have the title of Housing Stability Manager for the Department of Social and Health Services, and my administration is the Economic Services Administration. We are the TANF agency here in Washington State. Next slide. So the 100-day challenges, I want to give you first an idea of the scope of the challenges and what happened here in Washington State. So we had two 100-day challenges conducted in 2016. They were a joint project of two state agencies, the Department of Commerce, which is the state agency managing homeless housing, state funding, balance of state continuum of care funding, the emergency shelter grant, and the state and the National Now Housing Trust Fund. And the other agency is my administration, again, which I said is the state TANF agency. For the challenges, we hired a consultant from California to help us with the technical assistance and the direct work with the counties. And during the challenges, we provided support to 7 counties in total in the areas of setting goals for the project or for the challenge, adjusting systems, and measuring progress towards functionally ending family homelessness. Next slide. So why 100-day challenges? I think we want to answer that question first. So we had seen prior success in addressing veterans homelessness and chronic homelessness around the nation by using a 100-day time frame and some of the other elements of 100-day challenges. And we saw success, and we liked what we were seeing. Since our challenges, we have seen youth and young adult challenges to end homelessness, both across the nation last year and then this year in Washington State in a few counties. Here in Washington State, we are fortunate enough to have the Bill and Melinda Gates Foundation do some state work, and we were coming to the end of a 3-year grant from them, which was called the Vulnerable Families Partnership. And that was a partnership between my agency, the Economic Services Administration, the Department of Commerce, and it also included a person in the governor's office. And that partnership was focused on vulnerable families across the state and looking at what could be done policy-wise to work and provide benefits for vulnerable families. And so at the end of that 3-year grant, there was some remaining funding we had. The Vulnerable Families Partnership worked on policy first and foremost, and we saw this as potentially an opportunity to act with these remaining funds. And then it was also an opportunity in our state to focus on prioritizing unsheltered families with children. In our state, we had done an analysis that under 35% of our state's homeless grant went to providing housing for unsheltered populations. So we believe that too much of our funding was going to people who had other options and weren't this high priority population of people actually living outside. So it was to the ends of trying to get us to get more of the people that we served coming from unsheltered situations. Next slide. So the first challenge project was held in Cowlitz, Mason, and Thurston counties, and those counties were chosen from letters of interest that were submitted in a statewide RFP, I guess you would say. And the challenge was conducted February 26th to June 4th. Local TANF offices coincidentally participated as invited by the local lead who responded to the LOI. And a full day kickoff with county homeless systems, and we took the communities through a data walk of their own information from their own homeless system. And then for the remaining 100 days, weekly calls were held with the consultants, and then we held in-person monthly meetings with all team members from all 3 counties. The results from the first challenge were unsheltered family homelessness dropped by 61% in those counties, all told. 30% more families transitioned from living in places not intended for habitation to permanent housing compared to a similar 100-day period the prior year. And coordinated entry in one county, in Mason County, was developed from scratch. They had not yet embarked on developing coordinated entry, and so they were able to stand that up actually within 80 days, the first 80 days of the challenge. Next slide. The second challenge took place in Benton-Franklin. Those are actually 2 counties, but they work together, and Walla Walla County and Yakima County. It took place August 29th to December 7th. And local TANF offices in these cases intentionally participated. So in the LOI that we released requesting letters of interest, we asked the teams to invite their local TANF office to participate because it was such a best practice as identified in the first challenge that we decided to go ahead and make that intentionally part of the second challenge. Again, the same process identically was conducted during the challenge that we did a data walk in the beginning, we spent a full day with the counties, and then weekly calls with the consultant took place and monthly in-person meeting with all teams. And the results there were so similar, 64% drop in unsheltered families and 28% more families transition to permanent housing than a similar 100-day period the prior year. In the second challenge, a coordinated entry program was developed for Yakima County, and it was rolled out in March of the following year. Next slide. So the outcomes for us for the local TANF offices, the local TANF staff gained an understanding of homeless systems coordinated entry. So this is kind of a mystery new program type or new intervention or tool in communities. And so it took the mystery out of what that's all about and how coordinated entry works for TANF staff. So they learned about standardized assessments and what they look like and what families' questions were asking or being asked. Prioritization by vulnerability, so working by name lists. Shelter diversion, the concept of shelter diversion and not making families wait for a shelter bed before you assisted them. And then the concept of housing first or housing ASAP and speeding up the amount of time it takes families to get into housing. And then just the fact that unsheltered families are taking highest priority in communities. Next slide. The challenge outcomes for all participants were that they actually got to practice collaborating across systems. We talk about this a lot. I'm actually very passionate about collaborating across systems, but this gave communities a chance to practice this over a 100-day period. And the fact that we had a consultant working with them and we had state agency staff working with them and being part of the process, we actually got to try things, look at what was difficult, figure out how to work better together, and I think there was a lot of value in that. Cross-system awareness of the impact of homelessness on families. We had a comment from somebody who worked in a work source, an employment sector agency who was on one of the teams and was just struck by how much she learned about what families are dealing with that she didn't know about when they were sitting in front of her and she was doing the work that she would do with them. And so just a lot of awareness about what the impact is for kids and families. And then learning the value of and expanding the use of by name lists, that outcome I'm really excited about. I learned a lot about by name lists myself, and I think people really learned the value of what working a by name list brings. And then understanding how cross-systems work benefit each other's system. And my quick example on that is that we had a shelter and they came to a meeting that was not a 100-day challenge meeting. And they told us that they didn't understand or know that when they did resume workshops with their shelter families, that actually counted as a TANF work first activity, and that family could get that counted and given credit for that on the work first TANF side. So there are benefits to working cross systems that you don't understand until you start working together. And I think that's all of my slides. Yep. Thank you. Hand it over.
Thank you, Teresa. This is Sharon. And just because I know you're going to have to be leaving us a little early to go to a meeting, could you just define for us what you mean by coincidentally participated? I believe that's the TANF agencies.
Yes. So when we released the letters of interest and asked all counties in Washington State to consider joining us for a 100-day challenge, we didn't tell them the composition of the teams that they should put together for those challenges. And so they were allowed to just put together a team and come to the table. And all of them identified, all of the first three identified their TANF agency as being a part of their team. So it just happened to be, and we learned from that luckily they already saw value in inviting the TANF agency to their homeless system table.
Thank you very much. And so now I'm going to turn it over to Melissa Taylor.
Hi. This is Melissa Taylor. I'm currently the Program Development Director at Lower Columbia CAP, which means that I assist our agency in developing program ideas and funding to support that and responding to community needs. At the time that the 100-day challenge came about, I was actually at a different agency. I was the county point of contact for our homeless efforts, the liaison between the state and the county. So I looked at it at that time from a system point of view. And even though I was at the county lead at the time, CAPs have had an extensive involvement in homeless programs prior to that time, especially in Washington State. And it seemed to be a natural fit because of the array of program resources and the array of services that are available at community action agencies. So I'll talk a little bit more in a minute about what our specific role was. Go ahead to the next slide, please. So I just wanted to give you a sense of where we had been before the 100-day challenge started. And we had, as a CAP agency, Lower Columbia CAP, had great success with high levels of rapid rehousing and homeless prevention, primarily through the ARA dollars right after the response to the Great Recession. And we found that we were actually primarily looking at prevention and helping families avoid eviction during that time. And so we had that kind of under our belt moving in as a CAP agency to this challenge. And we also, from a system level, had Housing First approach embedded into our 10-year plan, which had been adopted in 2011. And since that money from the ARA dollars had come forth, CAP had been designated as the one-stop. We called it a one-stop. There wasn't coordinated entry at that time. And it was the designated one-stop for homeless services because we had so many other resources available to help people meet their basic needs. So we were already working in a Housing First mode from our 10-year plan that we had completed as a system. And because we had shifted from a housing readiness to a Housing First approach, we had to undertake a pretty thorough training program. So we made very affordable training workshops available to all of our members at a very reasonable cost. And we were able to bring in national and regional speakers and trainings to do this for half-day, full-day sessions in an economical manner because our county supported setting aside a portion of our homeless dollars to build those skills. So we had already made the shift to Housing First. We had built some skills to make that, to implement that successfully. And around 2014, we began initiating coordinated entry, and that rolled out in the summer on a kind of a soft rollout and then geared up in full speed in 2015. Another thing we did about that time was, based off of the recommendation from our CAP, we eliminated any kind of financial assistance for prevention, and that had been a big part of our rapid rehousing program from the ARA dollars. But we realized that you can't prove a negative. We didn't know those families were going to be homeless or not. And we would see them call up again almost exactly 12 months later saying, can I get assistance again? I know I can only get assistance once a year. So it was actually becoming more of an anti-poverty program than ending homelessness. So we decided to shift towards more prevention and diversion to address that need. And that was run through our coordinated entry program. We funded it as a life skill, and that means that our coordinated entry folks trained in that would help people understand the landlord-tenant law. They would help them negotiate a repayment plan with a landlord. They would help them identify other types of housing options that might be available to them in a crisis. So all of these things were going on, and we had also experienced quite a bit of success in meeting our 10-year plan goal. In 9 years, we had reduced homelessness 52%, and our goal was to reduce it at least 50%. So everything was moving along in a great direction, and then, of course, you know, things change. Next slide, please. So we had made a big change from, you know, looking at ending homelessness more as a crisis management system, and ending poverty as a CAP is a more long-term commitment to a deeper goal. And we had also looked at trying to increase the effectiveness of our system and each agency taking ownership in their part of making the entire system a success. Part of that was when we funded programs to end homelessness, we didn't create little mini systems within each agency. We said, okay, Housing Authority, you work with a lot of landlords. Why don't you do our landlord liaison program and, you know, do the rent well classes for our clients. So we tried to go with each agency's strengths, and they then were working with everyone's clients. And that focused more on the system than what each agency could secure for themselves and basically the populations that they were selecting. Then came an Ending Family Homelessness initiative from the state, and they took a portion of our regular doc recording fees and dedicated them towards ending family homelessness. And we started meeting with our community service office and TANF agency then, and we had a very cross-systems group working on that, and we did this for about a year and a half, and we made progress, but not as much as we'd hoped. And then when the coordinated entry came along, we realized that the whole world had changed. We were seeing completely different clients at CAP through our rapid rehousing program than we'd seen before. They were much more difficult to serve. That means that coordinated entry was doing its job. They were sending referrals based on the most vulnerable instead of using first come, first serve or waiting lists or, you know, who knows what resource to tap in the community. So it was becoming much more challenging work. And at the same time, the state kind of doubled down and said, well, we want you to serve at least 35% of everyone that goes through your system as unsheltered. And it was very much a wake-up call when we realized across the state that we were, most of us, far under that goal. Next slide, please. At the same time, we have a very slow, reactive housing market. It was just starting to recover from the Great Recession. Portland and Vancouver was a heated housing market. People were fleeing that market and coming up to our county because it was an easy commute, which made rents rise very quickly. Our vacancy rate plummeted to 1 to 0%. And at the same time, we saw homelessness increasing because housing was harder to come by. Rents were increasing, and people were falling into homelessness. And at the same time, landlords were becoming far more selective about who they would work with, tenant-wise and agency-wise. Next slide, please. Some other challenges we faced was lack of emergency housing beds. One shelter is limited to domestic violence. The other shelter has a lot of prerequisites for entry, and they have longer stays. So there was not a lot of turnover and not a lot of bed availability. Because our housing market was just recovering, we weren't collecting a lot of document fees, which is how we finance a lot of our local homeless system. And so we were seeing a decline in funding to programs. And this was also when we started seeing some serious division in our community being very visible between the Housing First approach and the Housing Readiness approach. There were calls for funding, shifting the funding and funding only Housing Readiness. It affected our county commissioner elections and the makeup of our current commission. And there were a lot of social media campaigns about this, and unfortunately a lot of misinformation that was out there. Next slide, please. So when the 100-day challenge came along, we were really excited. I was really excited as a county lead because it was an opportunity to see, you know, we can pick a small population and see some progress. We've got all these other things swirling around us, but we can focus on that and re-energize our coalition that way. And it was great because even though we didn't get more resources, we had the technical assistance to help us get unstuck. We'd already started working across systems with the Ending Family Homelessness Initiative from the state, but we could get a lot deeper into that. So we wanted to see if we could demonstrate how effective Housing First could be with our families to the entire community, especially with the controversy that was going on at the time. Next slide, please. So our Team Revolution, that was our name. We formed a cross-system work group, and we didn't include anyone if they could not commit to the weekly workshops. That was our core group. We had other people come along later who were able to join in, and that was great. We had a really great variety of people, different types of housing and health and human service providers at the table. Our community service office, TANF agency, was right there with us, which was fantastic. They were a huge partner in this and an essential partner in this because they were able to work with our frontline staff across all these different agencies and then take whatever barriers we were seeing or silos that we were running into. They were willing to take that back and advocate with that, and there were some modifications or waivers or workarounds in order to help us meet our goal, and that was invaluable. Next slide, please. So we developed, as a team, a project plan. In a nutshell, it was to offer an appropriate intervention for every unsheltered family that we could find within 1 month. And we are starting with diversion and trying to keep as many of them out of the homeless system as we could. We had already started this prevention and diversion program, and we just started to spread it and grow it. That staff that ran that program went out and trained 5 other agencies, as well as our entire continuum of care, on how to divert families from the homeless systems, and it was very helpful to everyone. And I think a big piece of success in that was training people at the school districts in that, because they see a lot of families in crisis. One thing that we thought would be huge but really wasn't was the release of information form. It turned out that wasn't as necessary as we thought. But brainstorming alternative housing options, that was really a great activity for the group. And also identifying as many landlords as we possibly could to find that would work with us to achieve this goal. And people would get motivated around this goal. It was a doable number. So the faith community, the landlord community, and service providers could all get excited about it. Next slide, please. And part of our tools in our weekly meetings was a heat map. Gina will talk about this in a minute, but you can see we had our 2 goals on the left, 0 unsheltered families, and then lasting system change. And then each of our activities, every week we visited this thing, all the different activities in support of those goals. And we would grade ourselves or score ourselves green, yellow, or red as to how we were doing towards meeting that goal. And we would generate more people to work on something, and when something turned to yellow, it really got the group motivated. Next slide, please. So what we saw was a lot of evolution and change amongst our service providers and the community at large, because we were able, our coordinated entry provider reached out to the faith community and they responded. Gina will talk more about that. They had never really interfaced with our programs very much prior to this time. Our housing authority got engaged and offered to dedicate some turnover vouchers for families, which was a new approach for them. And even though school districts weren't at the table at the time, they became really interested in partnerships going forward from this point, and that's maintained that interest. We had other agencies that permitted waivers that created barriers for program guidelines, and that was really something big that moved families forward. We had multiple points of diversion available in the community. And the big thing for me was we stopped thinking of permanent supportive housing and rapid rehousing as mutually exclusive programs or mutually exclusive outcomes. We used progressive engagement and tried to do the minimum possible. And if that didn't work, we added a little bit more or a little bit more, whether that was financial or case management. And so some of those folks actually did end up being folks that are more appropriately served in permanent supportive housing, and we're basically doing that sort of as through our rapid rehousing programs. We're just adding that extra layer of intensive case management. Next slide, please. So in wrapping up, our lessons that we learned was to define what success looks like. And for us, we had to really think hard about the fact that ending homelessness for that family may not be what we did. We might just end their unsheltered status. And we had to be willing to accept that, but then to continue to push on after that to work to end their homelessness. We had to be ready for agency pushback because there were other agencies that agreed to participate and send their people to this, but then they realized it meant changing some of their agency practices, and they were starting to question that. And then once it was explained, they were on board. They were with us on it. We also got some pushback on the fact that we were using Housing First, but not a great deal because people could get behind getting families out of doors or getting them from the out of doors. And another thing I would suggest is that you take more time to engage additional partners. We had a very short timeline getting into this thing, so we weren't able to bring along some of our partners that we wanted to at the time, but we did allow people to jump in when they were ready, and they've done that since, and that's been really great. So I think a key focus is, setting your short-term goals and following up. This weekly team meeting was just amazing in terms of getting us energized about carrying out our task and making it happen. We're still maintaining those systems changes, and it's really great to see how that has actually inspired even more changes in our system. We have other players that have stepped up and got more engaged in providing emergency housing or providing rental assistance. We have other agencies that are looking at reducing their program barriers. We've created a landlord liaison program. All of these things are outgrowths of this 100-day challenge. So it will not only get those families off the streets, it will change your system in unexpected ways that are really a lot of fun to see as it evolves. Thank you.
Great. Gina?
We actually had a question that came in for Melissa, if I can
okay.
It. Sure.
Yeah, why don't you interject then?
Sure. So Melissa, we did have one question that came in for you before we transition on to Gina, your colleague, but one of our attendees wanted to know if you could talk a little bit more about the success that you've had with diversion. In our experience, they say most people who have already exhausted their options with family and friends by the time they become homeless, so where are your families being diverted to?
So a lot of times people think that they are going to be evicted from housing when they get a 3-day pay or vacate notice, and so we educate them about the landlord-tenant law. And they realize that, wait a minute, they do have an option here. I can work with the landlord. This isn't a foregone conclusion in the legal sense. And so it was a lot of coaching and life skills, coaching around what the law permits, and then coaching around practical ways of, can you and I work together on a repayment plan, and then can we sell it to your landlord? So there were quite often times that situation. Or it might be that they were living with a family member. They had burned some bridges with maybe a whole variety of family members. And we would look at conflict resolution. Is there a way that we can resolve whatever it was that got that family member to say, I've had enough? And they would work with them. And that was also a very powerful way in which they practiced diversion. So oftentimes it was not finding them another. It could have included finding them another landlord, and then on occasion it did. But those are the two main pathways towards that.
Great. Thank you for that.
Okay, and I think Gina's going to give us more of the frontline day-to-day work, what was involved in CALITS to make this happen. So Gina, turning it over to you.
Good morning, everyone. My name is Gina Nugent, Housing Department Coordinator at Lower Columbia CAP. I provide case management and supports for everyone in our rapid rehousing program. And I'd like to share with you today just the CALS experience, maybe some steps we took to get towards functional zero, and just my impression of the 100-day challenge in a whole. Next slide, please. So how do you start? We were given this mission, but we really needed to understand how big the problem was. Next slide, please. Before we could reduce unsheltered homelessness, we needed a better idea of how big this population actually was. Concerns that households may not currently be engaging with coordinated entry or reporting their living situations to partner agencies due to stigma, fears of CPS involvement, or fleeing from their abuser triggered us to reach outside the box. Love Overwhelming, our coordinated entry provider, sent their outreach team into the community to identify and assess family households living in places not meant for human habitation, specifically targeting tents, vehicles, and following up leads collected from coordinated entry and partner agencies. Educating community partners on navigating the homeless system increased warm handoffs and referrals to coordinated entry. 24 households were identified as unsheltered families, a much smaller number than we had anticipated. Another surprise was that many of the assessed households did not score high in the VI SPDAT. At this time, rapid rehousing referrals were vulnerability-based, which would eliminate many of these households from access to this intervention. At this point, we chose to prioritize housing statuses instead, as opposed to vulnerability score for rapid rehousing referrals. Next slide, please. Some of the challenges we faced coming out of the gate was a housing vacancy rate of 1%. In 2016, the housing market was beginning to heat up, and people fleeing high prices from the Portland-Vancouver housing market drove housing prices up significantly, beyond the fair market rent limitations of our funding sources. We had to get creative. One funding source allowed for double deposits to increase access. Another allowed first, last, and deposit. We mailed out letters to past and prospective landlords explaining our mission to end unsheltered family homelessness and asked them to be a partner in this fight. There was not a lot of availability in our emergency shelters. After many years of reducing homelessness in our county, homelessness was beginning to increase, most likely due to the rising housing prices. We entered this challenge at a time when our community wasn't very supportive of homeless services. Landlords had been burned by past assistance programs. There was a lot of negative messaging around the homeless population in general. We learned from this and used this opportunity as a platform to educate. We educated fellow service organizations, school district liaisons, and the Housing First Coalition around navigating the homeless system and using prevention and diversion to assist households avoiding the traumas of the homeless experience. We messaged the attainability of functional zero for unsheltered homelessness and saw people get excited. Next slide, please. For this project, we were tasked to end unsheltered family homelessness using the resources that were already available in our community. Love Overwhelming's coordinated entry portal increased the capacity of their prevention and diversion program by cross-training all agency staff. This resulted in reducing the number of households entering the homeless system overall. This allowed them to perform prevention and diversion navigation for all unsheltered households. Prevention and diversion helps households to identify resources in the community and their social networks to meet basic needs, including housing. For instance, staff was able to engage people in learning how to negotiate repayment plans to prevent housing loss, or negotiate a waiver of startup costs to access housing. Sometimes the coaching was to help them reunify with a family member where they had burned some bridges. Because we had only 24 unsheltered families, it seemed doable to end unsheltered family homelessness. Outreach to the faith community resulted in donations for hotel rooms, moving costs, and even finding a landlord or sponsoring a family's housing. Prevention and diversion staff coached households on conflict resolution and communication with their landlords, at times providing landlord mediation. Next slide, please. For those that could not be diverted from the homeless system, coordinated entry sought shelter stays. Unfortunately, our community shelter is very limited, and with one general shelter that prioritizes families and one shelter reserved for victims of domestic violence. Because our general family shelter serves a mixed population of singles and families, they also have high barriers to entry. Some families were not eligible for emergency shelter. When shelter beds were unavailable, small funding sources donated hotel rooms. When our team staffed the situation, we considered looking into the faith community. Caleb Luther, formerly with Love Overwhelming, reached out to the Faith Network, informing them of the 100-day challenge and messaging that ending unsheltered homelessness was attainable. I believe at that time that there was about 14 households who had not secured housing. The faith community jumped on board, and based on monthly donations, we were able to provide hotel stays for households while they looked to secure shelter stays or permanent housing opportunities. These funds have now been matched by the Help Us Move In program, increasing local capacity for temporary assistance to obtain permanent housing. Next slide, please. Lower Columbia CAP, as the rapid rehousing provider for Cowlitz County, opened referrals for all unsheltered households as prioritized via coordinated entry. All identified households that could not be diverted from the system were referred and intaked into the Consolidated Homeless Grant. Shortly after starting the 100-day challenge, the team identified that several households would benefit from a short-term intervention. Using a progressive engagement approach, we modified our policy to provide a light-touch rapid rehousing intervention that would initially offer household startup costs plus an additional 3 months to assist in stabilization. Once housed, households would be reassessed monthly to determine need. Individuals who could not stabilize in these 3 months would qualify for additional assistance and increased support, allowing us the most appropriate and affordable intervention possible and increasing our capacity to assist more households. Inspired by the 100-day challenge, Housing Opportunities of Southwest Washington, our local housing authority proposed and approved a prioritization for unsheltered families to access a percentage of turnover housing vouchers. These referrals were received ongoing case management from partner agencies to ensure housing stability. CAP assists with households as needed with move-in costs for these Section 8 vouchers. Next slide, please. All households engaged in rapid rehousing assistance receive case management. We work with families and individuals that are chronically homeless, survivors of domestic violence and crime, exiting systems of care, or maybe experiencing homelessness for the first time. Because every household is unique, we practice client-centered services, allowing the household to define what housing stability is to them and seeking resources to help them reach these goals. Our rapid rehousing program practices a housing-first approach, focusing on meeting a household's basic needs, removing them from crisis, and providing a healthy foundation for growth. We do not require sobriety or mandate participation in mental health services or other support. Case management promotes harm reduction practices and education. The only requirement is that they engage regularly with case management support. Like our rent assistance model, case management is a progressive engagement model. Most households need intensive supports to meet stability goals. Others are self-motivated or have a strong support network. Everyone is in a different place when they enter into services and evolve and change throughout the program. Service plans must be fluid and always evolving. We work with a household who was a recent survivor of domestic violence and had made great progress in developing coping mechanisms and supports. She was actively seeking employment and secured housing immediately after entering services. One day, when she was driving only a block from her house, her vehicle was struck by a bullet. As a woman who has experienced great trauma, she was afraid to leave her house for weeks. Service providers immediately sensed her disconnect and wrapped her in support services. She felt her journey start over from the beginning. She had to work through this past trauma and fears and work towards leaving her apartment again. It was several months before she was released to start work search. This is just an example that your level of service can change in a second. And just to give you some closure, she's no longer in our services and has acquired an amazing job working in the mental health field. Next slide, please. Throughout the 100-day challenge, we continued to invite providers to the table weekly to case conference, working to assist each other problem-solve difficult client scenarios, navigate around barriers, and educate each other on policies and procedures that can help us as providers when providing resource navigation. As a provider who thought she had a pretty good idea on how to navigate the DSHS and other similar partner agencies, I sure did learn a lot. It's made me a stronger and more effective advocate, and it's something we still try to continue to do on a monthly basis. The technical assistance calls were essential to gain perspective, removing us from our bubble, putting our system hats on, and looking for solutions. We were motivated to try new things even if they fail. When we presented ideas, we were given resources of other communities that have tried something similar, so we didn't have to reinvent the wheel. We redefined success, making functional zero an attainable goal. Next slide, please. During our weekly technical assistance calls, we discussed goals that were noted in our Heatmap, staffed difficult cases, and remained up to date on our progress in assessing and housing unsheltered households. The Heatmap was an effective tool. It provided a visual indicator of our progress. If activities were stalling, it would trigger discussion around whether it was the right direction or if it could be addressed differently. Each week, we delegated tasks to each individual to complete which encouraged continued momentum. We continued to use this tool for some time following the challenge completion. In our discussions with Kathy, she encouraged us to define what success means. In our pursuit to reach functional zero, diverting a household off the street was a success, even if that meant emergency shelter. That took some time to wrap my head around, particularly as a rapid rehousing provider. Right before the 100-day challenge, the managing agency of our homeless system had delivered discouraging news about financial resources. The housing recovery all around us was not showing up in the document recording fees each county collects when homes are sold to finance the homeless system. State resources had been significantly reduced. We were told for only a year. So when we entered this challenge, we had less resources than we had available in the past, and clearly no additional resources for a new initiative. We were forced to change our lens and look at our system as a whole, identifying its weaknesses and proposing change. We were also encouraged to use a progressive engagement approach around rapid rehousing, much like we did in our case management. Assist households with minimal financial and supportive resources as possible, reassessing and increasing these resources as needed for those that struggle to stabilize. Therefore, even the most vulnerable households could still attempt to thrive without more expensive interventions such as permanent supportive housing. Being able to staff individual cases weekly amongst fellow providers was essential in reducing barriers. Through this progress, we received education on how different systems work, uncovered resources, and identified systemic barriers, and at times, ways to navigate around them. Many of the providers at our table worked with the same households, and without exchanging identifying information, we could communicate effectively and give input on each case. Next slide, please. The key to our success in moving towards functional zero was having all the players at the same table. There were voices in healthcare, social services, education, housing, homeless services, and so forth. Ground-level voices. These individuals hold the hands of these families experiencing homelessness every day. They hear their stories, succeed and fail with them. There's no one better to highlight system barriers other than the clients themselves. Once we had all the providers at the table and working towards a similar goal, promoting change in the system was fairly easy because we all had a stake in it and wanted to be successful. Have a list. Coordinated Entry held a list of all our unsheltered families, and we would discuss our progress weekly to see how many were offered interventions and how many were housed. It was extremely motivating to see progress and to see that you are making a difference. Now, we did not succeed in establishing a community ROI, so the names were not shared, but providers had a general understanding around shared clients that were being staffed, so this was not a barrier. For our team, the Heatmap was essential at maintaining momentum. We all have very busy schedules, so knowing that you had this task to complete by the end of the week kept you motivated. You're also able to visualize your progress towards completing these goals, which made it easier to identify them and identify when we needed to adjust our approach or change direction. And finally, I think our biggest lesson was that anything is possible. Through this journey, all our preconceived notions on how the homeless system worked, financial constraints, and policy limitations have been shattered. With education and inspiration, we were able to accomplish systemic changes in how organizations operate in our community and continue to remain operational a year later. New opportunities emerged just to reach out to the community, educate them, and ask them to be a part of the solution. It was an inspiring experience.
Thank you very much, Gina. So I think we're probably going to have lots of questions for you and Melissa. But before we turn to them, I'd like to introduce Melissa Hess.
I am Director of Housing Services at the Benton-Franklin Community Action Connection in Pasco, Washington. And so I wanted to share with you guys a little bit about our geographical area first. That way you understand a little bit more about some of the difficulties that we face. So we are located in southeastern Washington. We are primarily, I would say, rural. We have probably about 5 or 6 rural cities, but then we have 3 major metropolitan areas: Richland, Kennewick, and Pasco. Our biggest commodity is potatoes, apples, grapes, so a really large agriculture area. Our total coverage area, service area, is 2,942.55 square miles. So that's a lot of area to cover for one little cap agency. Next slide, please. So a little bit of background on our agency is that we're Community Action Connections. We were established in 1966 to support low-income families in our community and to help them to develop a pathway out of poverty. We offer a whole bunch of different programs, and all of those services have been identified to have a measurable impact on reducing the causes of poverty. Included in some of those programs are rapid rehousing, homeless prevention, permanent supportive housing programs, and we recently opened a day center for families with children that are experiencing homelessness. So as a leader in identifying unmet needs in our community, we work with partner agencies to help expand services to best serve the people in our community. Sorry, I got a little bit tongue-tied. Next slide, please. So before the challenge, our housing crisis response system did not adequately respond to the needs of our homeless families. We underutilized best practices in rapid rehousing. We only have 1 emergency shelter. It doesn't accommodate single-father households or households in which a male child over the age of 13 is residing, and so that leaves a lot of families in our community unsheltered at night. It was difficult for families to navigate our system in order to access any services. And among providers, we lacked communication, but also definitions, which is really important when you're working with households that are experiencing homelessness or at risk of homelessness. Next slide, please. So one of the biggest tools that we got from, excuse me, the challenge was the development of our information team, or our I-team. So we had our best and our brightest in our area come together. We committed to meeting as a group weekly. We were able to develop a common goal for what we wanted in our community. And then once we had that, we were able to identify weaknesses in our system that keep us from reaching that goal. And we were able to collaborate on ways to strengthen our system to better meet the needs of the families we serve. Next slide, please. So our meta goals, or major goals for the challenge, of course, were 0 unsheltered families and lasting system change. So these are ways that we had decided we were going to meet those goals. So we wanted to identify and track unsheltered families in our community, increase outreach to our unsheltered families, and increase the availability of emergency sheltering through motel vouchers. As I mentioned, we only have one emergency shelter. We do have a domestic violence shelter as well, but that is for, of course, that prioritized population. So our big option to get people off the street was to increase those vouchers. For lasting system change, we needed to look at reducing our documentation requirements and the barriers to accessing services. We have a lot of programs or services that are conditionally offered. You know, it was based on were they ready for housing, were they engaged in services, and so really looking at, like the other presenters mentioned before, housing first and low barrier shelter options. We needed to develop and implement a prioritization tool where we were prioritizing unsheltered versus sheltered families first. We had to look into what is diversion and what are those best practices and how do we make that work into our community, and then to identify and implement landlord recruitment strategies. We deal with the same struggle of very, very low vacancy rates and rent costs just increasing through the roof. So we need to get out there and we need to build our pool of landlords. Next slide, please. So the results of the challenge in our community were increased collaboration between our partners. We developed that common vision and the common knowledge, so we're all on the same page when we're talking about something. We were able to identify and implement some of those needed system changes to increase the effectiveness of what we were doing. Biggest one was reducing barriers and the documentation requirements for our coordinated entry. That families could come in, that would be their starting point. They would just gather verify homeless status, some basic income information, and then they were able to be sent to the service providers where trained case managers could help to develop that housing stability plan and work with them to get whatever else they needed. And then, most importantly, we reached 0. On October 24th of 2016, we reached our goal of 0 unsheltered families sleeping in Benton-Franklin counties. It seemed like it was going to be, and not that it isn't, it's still a struggle. The system is always looking for ways to improve. But really, once we all sat down and said, this is what we want to do. We want to get our families off the streets, and how can we do that? And we were all aligned. We just brought them in, got them housed, did our jobs, and had a little party. And we got all this really cool flag stuff. You'll see the pens, the 100-day pen challenge with the gold stars and the check mark. And I'm a little bit of a nerd, but stuff like that makes me excited. So, and that's it. So, any questions?
Hi there. I think we'll wait for the federal advocacy priorities. This is just sort of two summing up slides that I've put up there. So I have a couple of questions, but first I'll turn it over to, well, why don't I take the sort of facilitator's prerogative here and ask a question, and then we'll take them from the chat. So, Melissa Hess, could you talk a little bit about, because I heard less there, about how systems might have changed, so the TANF agency being involved, or public housing agencies being involved, or schools. Did anything change because of the way that you were working with them, and anything that's like new policies, new practices that have evolved because of this 100-day challenge?
Well, we were able to bring our community services office administrator to the table, and he oversees the TANF program. And so we were able to have anybody who was identified in their, I believe it's the ACES system or the BVS system, they have a way of categorizing households, whether they be homeless with housing, homeless without housing. And so we were able to get together, look at who in their system was labeled as homeless without housing, and then send out referral notices. So we would just send out flyers saying, hey, this is where our coordinated entry is located. Go there, get some help. So increasing the outreach, and then same thing with the participation, looking at ways that we could count participation in the housing search or employment classes with the participation for their individual responsibility plans and TANF mandates.
Great. Melissa Taylor and Gina, the same kind of question for you. You did talk about how, being involved in the TANF system and everybody was around the table. Could you speak to actual sort of concrete policy changes and the kinds of waivers that were offered and their receptivity to that?
So I can think of a couple of examples where, and Gina could speak better to this, but during the case conferencing, a specific family example would come up and they would say, well, we can't get this person into this intervention because they have this thing that's kind of following them wherever they go, and some of that is they just don't have resources they could access through TANF normally. And so we talked with them about modifying their program guidelines to be a little bit more flexible if a family was seeking housing to, and they were in sanction already. And that was kind of, I think, one of the more typical situations where they would make an extra effort to either engage that family or offer them some alternate pathway. Or other providers might come up with suggestions and they would go, yeah, that would work. So, Gina, can you think of a better example or a more common one?
Well, just to connect with the one that you're giving is they would make housing search a work-first activity, so that would be part of their participation instead of having to juggle work search when you're literally homeless or in your vehicle.
And I think another one would be, we had some folks that were experiencing some behavioral health issues, and so it was very difficult to have them progress neatly through a ladder of accomplishments. And so I think intensive case management and a lot of times bringing the outreach team in during the intervention, not just at the beginning to count how many are out there, but getting that intensive case management piece in there to help them walk with them through the process, I think was also going a little extra mile for several partners.
Okay. This is Sharon, and I just want to remind folks to send questions to the chat box if you have any, and I have one from Nebraska, and this is, it might be for both communities, I'm not sure, but when you're doing diversion, when you're doing, when you're interacting with people who have, if they had a 3-day eviction, I think it might be different in all states. So how are you engaged with legal assistance and legal aid to make sure that people's full legal protections in the eviction process are being protected?
Well, this is
so
Melissa.
Sorry.
Oh, sorry. Go ahead, Gina. You can go ahead.
Okay, so in Caledon County, we work very closely with Northwest Justice Project, which is our free legal aid in the community, and we actually have one of their advocates that will work with clients by referral and as a walk-in, so that's been a great resource for us.
And same in Benton-Franklin counties, that we under no circumstances give any legal advice because we are not attorneys. However, we do, we become well-versed in landlord-tenant laws. We keep those on hand for our participants, and the Northwest Justice Office is literally right behind our building, and so we work closely with them. And if there's any referrals that need to be made, we do so.
Great. Could you talk a little bit about the partnership with the schools? I think one challenge lots of communities have is the school liaisons are charged with addressing a much larger population and a much larger group of families than families in the homelessness world. How have you, what specifically have you tasks, or what's the role of the schools in helping to identify families who are at risk or unsheltered in helping to solve their housing needs? How's that all connected?
This is Cowlitz. I would just say that since the 100-day challenge, we have a much stronger partnership with our school liaisons as well as our school districts. Our school liaisons show up at our coordinated entry partner meetings. They show up at our monthly case conferencing meetings. They are much more participatory, even though they are tasked with, they have a lot of things on their plate, like you said. So time is a especially critical resource for them, but it also raised the profile, I think, at the district level, and we've had a couple of districts seek out particular partnerships with some of our agencies to address either young adult homelessness or family homelessness, like joint partnering on a grant application or getting the diversion training in the schools.
Great. Okay, so I have one last question, so if anything else comes up, please submit it now, and otherwise we might close this great presentation. And that is, I think, you know, Melissa, Taylor, you and Gina, you raised an issue, I think, that a lot of communities are still kind of struggling to get to, and that's you know, not seeing rapid rehousing and permanent supportive housing as two different initiatives, but things that need to be interlocked, so that we're trying rapid rehousing lightly first and having permanent supportive housing sort of at the back end when and if it becomes absolutely necessary. So really triaging that intervention. That's, I think, something that a lot of communities are struggling with, how to have everything line up just so that it becomes quite seamless. Any tips for folks who are on the beginning end of trying to do that?
Well, I'll just ask Gina to add some thoughts afterwards, but I would say that you know, we really had a consultant that emphasized progressive engagement, and so we just took that to the nth degree, and we thought, you know, we don't have enough permanent supportive housing. I mean, who does? So let's take and see if we can help them to succeed with rapid rehousing. And it was surprising that some of those we thought were PSH-level families actually were able to succeed with just more supports. And also, when someone comes through your coordinated entry, they may not have a long history with the coordinated entry folks, and they may not disclose everything that actually would indicate that they are candidates for permanent supportive housing. So you quite often only learn this as you go. So having it be more of a continuum of having the PSH if you need it is really helpful, because on a practical basis, they don't disclose a lot of the things that would kind of put them in that box on the front end.
Okay. I have a question, and I'll ask it to both Melissas. So I'll start with Melissa Hess, actually. How have you structured your coordinated entry? Did you have to hire new staff to create a single point of entry? How does it function? Both communities that we're talking to today their homeless service system is relatively small, I believe. Melissa Hess, do you want to start us off?
Yeah, so currently the way that our community has our coordinated entry set up is a centralized coordinated entry, meaning we only have one place that families can go to be screened for the housing services. I think with everything, you kind of try it out and see how it works. Some difficulties that I hear from participants is, you know, I mentioned before kind of how we are geographically and the breadth of our service area, and so sometimes it's really difficult for people to go from the Union Gospel Mission in Pasco all the way over to Kennewick to be screened for rapid rehousing services, and then they may have to come all the way back to Pasco to actually see somebody and receive the assistance. And so we haven't had to add any new staff. That it's still working mostly with our coordinated entry, just lowering the documentation barriers, looking at the progressive engagement, looking at housing first, and getting people sheltered. But I think there's still stuff that we could work on to make it better.
Okay. Melissa Taylor?
So in Cowlitz, we spent about 14 months with all the providers around the table trying to figure out how we wanted our coordinated entry system to work. And their unanimous recommendation was a centralized system. They thought that was much more efficient. And then with evolving into a capability to do mobile assessment. So initially, our coordinated entry was a one physical location, and it was located within a shelter. And they are now located actually within Lower Columbia CAP, which has been, I think everyone would agree, opened up the accessibility. I think some of it was the stigma associated with going to a shelter for coordinated entry. But the other thing is that, you know, we were the one-stop originally before there was coordinated entry, because a lot of people come here first because we're the anti-poverty people. And so they're located within our agency, and we're centrally located in the county. And I think people feel more free to access it. And at the same time, they've added that mobile outreach component so that they can do this on laptop and meet people either in the south end of the county, or if they're not comfortable coming into this location, they could meet them at a coffee shop, however that might be necessary. And then a recent addition is a grant between the coordinated entry agency and one of our school districts to have a tighter linkage to do more assessment and referral more frequently in their part of the county. So it'll be interesting to see how that improves our access. You know, that's one great way, starting with a central point and then expanding outward from there over time. And they haven't added any additional staff. They've just kind of shifted what people do within the agency to make that happen.
All right. Well, Melissa Taylor and Gina Nugent and Melissa Hess, thank you all so much for sharing your experience. Teresa Fletcher had to sign up early, but a recording of this webinar will be made available. And I can tell you at the National Alliance on Homelessness, we are going to tap the experience that these folks have had, because I think there's a lot to be culled here. And so many, I was just taking notes as you all were doing your presentation. So I think it's, so thank you very much for being so generous with your time. Before we let everyone else go, I just kind of want to remind folks that the capacity of people at the local level to respond to family homelessness and to chronic homelessness, to veteran homelessness, is all dependent on appropriations, and that's something that's a big focus of Congress in the next few weeks and months. And so if you have never done it before, the National Alliance to End Homelessness has a bunch of tools on its website, ability to just click a link and send a message to your congressional delegation. It doesn't have to be very complicated. Just we're helping to end homelessness, and we really need maximum funding for the homeless accounts. So it's, you should be doing it for community action agencies too, I would imagine, but just a plug. You know, a lot of times we don't necessarily know that the healthcare expansion has much to do with us in the homeless service world, but it does. I think that a lot of the permanent supportive housing that's been developed, the idea is that Medicaid is providing a lot of the supportive services for people with major mental illnesses and substance use disorders. It's critical. Some of the proposals that's being considered this week, today, tomorrow, the next day, would restrict Medicaid for very vulnerable people. So we hope you weigh in. This is, again, something critical to ending homelessness. We have some tools on the National Alliance website, which is endhomelessness.com. So please take a look. Next slide. Yeah, so just, so the National Alliance's Decreasing Family Homelessness webinar, we're doing two webinar series with the Community Action Partnership, is closing this week, and so in the last minute rush, we're doing 2 in 1 week, so I apologize for that. What we want to do on Thursday is take a look at where we've been, but more important, where we are going. And one of the things that strikes me is that community action agencies are a force to be reckoned with in statewide efforts to end homelessness. So I kind of want to see if we can steer a conversation to, you know, what is the role of community action agencies within a state to create progress across the state, as these 2 counties that we've been hearing from have done. For Washington, there was some, you know, statewide progress, even while there was some exceptional progress in their own counties, in their own jurisdictions. On Thursday, September 28th at 2 p.m. Eastern Time, one of the speakers is from Nebraska. She is a community action agency that is also, she runs the community action agency, and she's also responsible for the Nebraska Balance Estate HUD resources, and for the first time ever publicly, the Nebraska Balance Estate achieved functional 0 in ending veteran homelessness. They also reduced family homelessness by about 1/3, so she's going to speak about what they did there. We are also going to hear from somebody from the Maryland Department of Housing and Community Development, who is in the process of launching a learning collaborative around rapid rehousing for, you know, there'll be providers across the state of Maryland, but 1/3 of the selected providers are community action agencies. So they'll both provide presentations, but then I would very much like to hear from you, suggestions, or whoever is participating, on what tools, resources, other things that the National Alliance to End Homelessness or the Community Action Partnership or the U.S. Interagency Council on Homelessness, what could we be developing for you as a community action agency so that you can, you know, more effectively deploy your resources as a community action agency in the effort to end homelessness, and so that we're mobilizing all resources. So last slide is just my contact information. And I want to thank everyone for participating. Please don't hesitate to reach out to me with some suggestions. We at the National Alliance to End Homelessness think very much about the potential that exists when homeless services and community action agencies are deploying together. So thank you all for all of your time.
Thank you, Sharon, and thank you once again to all of our presenters who made today's event possible. We really appreciate, again, as Sharon said, you all taking the time to share your experience and expertise with us, so thank you very much. Just as a reminder, a couple of times, please note that today's webinar will be recorded, and that recording link and the slides will be made available to everyone through a follow-up email within the next few days. So just a couple of concluding things on our end from the partnership. Of course, here is Sharon's contact information if you want to reach out to her, provide any feedback on any of the resources that you talked about, or want to get connected to more things that the National Alliance is doing, please feel free to reach out to her. So here is a further description of the next webinar event that we have in this series. It's going to be taking place later this week on the 28th. And Sharon talked about that a lot, but you can find the registration information for this event on the partnership's website. And here's the contact information for the learning community staff. Please feel free to reach out to any of us with any questions, concerns that you might have. We would be happy to direct you as best as we can. So with that, that will actually conclude today's webinar presentation. Thank you all so much for joining us. Thank you once again to our presenters, and make it a great day. Thanks, everyone.